Hi, and good evening, everyone. Thank you for joining us this Tuesday evening. I'm Fran Jansen, and I'm with the State Treasurer's Office. And on behalf of the Central Arkansas Library System and the Arkansas Financial Education Commission, I want to welcome you to our webinar series tonight. Tonight's session is called Navigating Medical Bills and Debt, and is co-presented by the two ladies joining me, Berneta Haynes, who is with the National Consumer Law Center, and Signe-Mary Mckernan, who is with the Urban Institute. So briefly, a little bit about Signe-Mary and Berneta. Signe-Mary is Vice President of the Center on Labor, Human Services, and Population, and co-director of the Wealth and Financial Wellbeing Initiative there at the Urban Institute. And the Urban Institute is a Washington, D.C. based nonprofit research organization that seeks to help change makers strengthen decision-making, create inclusive economic growth, and improve the well-being of families and communities. Signe-Mary has 2 decades of experience researching access to assets and credit and the impact of safety net programs. Before joining the Urban Institute, she was a lead economist on credit issues for the Federal Trade Commission. She has been a visiting and adjunct professor at Georgetown University. She has testified before Congress, which I bet that was a lot of fun. She's been cited in media outlets such as the New York Times, Washington Post, Forbes, and Time, and she has a PhD in economics from Brown University. Berneta Haynes is a staff attorney with the National Consumer Law Center, where she focuses on consumer energy policy and medical debt. The National Consumer Law Center is a nonprofit organization headquartered in Boston, and they work with nonprofit and legal services organizations, private attorneys, policymakers, federal and state government, and the courts across the nation to help financially stressed families build and retain wealth and advance economic fairness. Before joining NCLC, Berneta served as director at Georgia Watch, which is a consumer advocacy organization in Atlanta. She also practiced law at the Environmental Law and Policy Center in Chicago and the Southern Environmental Law Center in Atlanta. Berneta has earned her bachelor's degree from Drury University, her master's from the University of Iowa, and her law degree from the University of Iowa College of Law. But most importantly, Berneta is a Little Rock native. So I welcome both of you. And just real quickly, we have the chat feature. So throughout the presentation, if anybody has any questions, please submit them during the chat. And I will be sure and ask the questions at an appropriate time, either while they're presenting or at the conclusion of their presentation. And finally, tonight's session is being recorded and will be available on the YouTube channel that CALS has, as well as the Treasurer's website. So afterwards, if you want to come back and watch it or share it with family and friends, you'll be able to do so. So with that, I'll be quiet and I'm going to turn it over to Signe-Mary.
Thank you. It's great to be here. I'm going to share my screen so others can see. And this evening, I'll provide an overview of medical debt in Arkansas so that you know how to check for it yourself and that you know that you're not alone in having it. Then I'll start to talk through, well, what can you do about it? And Berneta Haynes, as Fran mentioned, an attorney and medical debt expert from the National Consumer Law Center, she'll go deeper into more on what you can do about it. So we know that nationally, about 29%, so nearly every third adult you pass has some form of debt and collections on their credit report. And in Arkansas, the number's higher. It's 37% of adults have debt and collections. And you may hear about good debt or bad debt, but there is no good debt and collections. So what is debt and collections? It's credit that's past due, usually 180 days late, and it's unpaid bills that are reported to the credit bureaus. Medical debt and collections is the most common form of debt and collections. It's unpaid debt and collections owed to hospitals and to other medical providers, and it makes up about half of all debt and collections, according to the Consumer Financial Protection Bureau. Nationally, 15% of Americans have medical debt and collections. It's geographically concentrated in the South, as you can see on this map, where it's more darkly shaded. And then in Arkansas, every fifth adult, or 20%, of adults with a credit report have medical debt and collections on that credit report. This is a systemic issue. If you have medical debt and collections on your credit report, you're not alone and it's not your fault. The statistics that I'm citing here are from Urban Institute's Debt in America, an interactive map, which anyone can use to look up the amount of medical debt and collections in their county. So this map here shows the counties in Arkansas. And what we see is that no Arkansas county is free of medical debt and collections. The more darkly shaded counties, again, on this map have a higher share of adults with medical debt and collections. 662, that's the typical amount or the median amount of medical debt that's been recorded to credit bureaus in collection. And if we look more at where it is, we see that, where it's located in Arkansas, that the share of Arkansas adults with medical debt and collections ranges from 40% in Poinsett County to 13% in Pulaski County and to 13% in Montgomery County. And if we think about, well, who is most affected by medical debt and collections? In Arkansas, we know that people in communities of color are almost twice as likely not to have health insurance as people in white communities. And from wealth inequality research, we know that Black people are not provided the same opportunities. In 2019, the median US Black family had 13 cents of wealth for every dollar held by white families. Or put another way, the typical white family had 8 times the wealth of the typical Black family. So our country continues to cope with discrimination, and the low wealth resulting from it is being passed from generation to generation. Urban Institute research finds that white families are about 5 times more likely to get a large gift or inheritance. And these are disparities that contribute to the wealth gap, because this is money that can be used for major family investments like attending college or a down payment on a home. And wealth cushions families against emergencies, such as an unexpected medical bill, and gives people the means to move up the economic ladder. So addressing structural barriers, such as having quality health insurance and policies to support wealth building, such as baby bonds, could go a long way toward improving access and the ability to pay medical care, strengthening all Americans' overall financial picture. So one thing that's a little bit of a surprise when we look at medical debt is that younger generations, Millennial and Gen X shown here, are more likely to have past due medical debt than baby boomers and people in the silent generation. And this is a bit of a surprise because you'd expect older Americans to have more health problems and so more past due medical debt, more debt and collections. But these findings are also consistent with what we know about health insurance. We know that people who have health insurance are at lower risk of having past due medical debt, and people over age 65 in America have federal health insurance thanks to Medicare. This finding that millennials and Gen X are more likely to have past due medical debt is also consistent with what we know about wealth. Younger generations are stagnating, especially when compared with older generations. In the United States, the expectation is that every generation does better than the previous generation, but this is no longer necessarily the case. As this past due medical debt finding shows, This isn't just wealth in an academic sense. It's living with a soft landing in emergency. So why is medical debt and collections important? Why should people care about it? Well, for people who have debt and collections on their credit report, it creates problems not just for today, but for tomorrow. Debt and collections in general can lower your credit score and make it harder to borrow or access credit in the future, such as when you want to borrow to get a mortgage or borrow to invest in a small business. And it means that when you do borrow, it's going to cost more. So people with a subprime credit score, subprime borrowers, pay about $3,000 more in interest when buying a $10,000 used car. We're going to pay about $1,300 more when buying a refrigerator, and nearly $400 more when borrowing to repair their car. And if you're talking about buying a home with a subprime credit score, you're talking about $87,000 more in interest when buying a $250,000 home. But it's not just credit, it's other parts of your life too. Credit report information can be used and is used, I want to say roughly by about half of employers to determine eligibility for a job. When you go to rent an apartment, it can be used whether to access rental housing as well as those mortgages, and sometimes considered in insurance premiums. Plus, families with medical debt report that it reduces their ability to save and afford basic household needs. It means that people are more reliant on credit cards and other forms of credit. Medical debt damages their credit and then also makes them skip needed health care. So these are just some of the reasons why it's important. Okay, but that's all a little bit depressing. So let's get into what you can do about it. As I said, you're not alone. So what are some of the solutions for medical debt? What can you ask your state to do about it? What can you ask your employer to do about it? And what can you do about it yourself? So first thing I would say would be it's important for states, and 12 states haven't yet, to expand Medicaid. And I want to say congratulations to Arkansas because the state's already done that. So Arkansas is one of 39 states which has adopted Medicaid expansion. And this is important because research shows financial improvements in states that have expanded their Medicaid programs. That increases health insurance for residents in the state. And some of that research evidence shows that people are less likely to have new medical debt and collections come on the report, improved credit scores, and reduced bankruptcy filings. Other things that the state can do are dedicate more resources to providing greater access to affordable health care, because affordable health care is so important in whether or not you have medical debt and collections. And then also improving access to dental care would likely have a significant impact on medical debt. So these are things that you can let your policymakers know that Arkansas needs, using the evidence that I've provided about why it's important, such as Debt in America, some of those statistics. All right, if you're an employer, what can you do? Or what can you ask your employer to do? One option is to start a small dollar emergency loan program, so that when your employees have an unexpected medical bill, they don't have to turn to high-cost alternative financial service loans, such as payday loans. You can start a small dollar program for your employees. Another thing you could do would be to provide quality jobs with healthcare and with retirement savings, or to help employees automatically enroll into programs, government programs that provide those. All right, and what if you're an individual? What can you do? Well, you can contact a credit coach or financial counselor. If you have medical debt and collections on your credit report, we'd also recommend that you use emergency savings before borrowing more to pay off debts, and then make at least the minimum payment on all your different debts if possible, rather than say paying a lot on one and not paying any on others. That will help keep your credit report clear. And then, some good news is that even a small amount of emergency savings can help families be resilient. So a savings cushion of as little as $250 to $749. Research evidence shows that with that amount of savings cushion, when you have an unexpected job loss, a health issue, or maybe your income drops, you're less likely to be evicted, you're less likely to miss a housing or a utility payment. And of course, higher levels of emergency savings are even better. We see that savings are at least as important as income, that families with $2,000 to $4,999, even if you have low income at that point in time, if you have that kind of emergency savings, you're more financially resilient than higher income households who are living paycheck to paycheck. So next, I'll turn it over to Berneta for more on what you can do if you have medical debt and collections.
All right. Hi, everyone. This is Berneta from NCLC, and I'm going to talk with you all a little bit about some of the ways to actually minimize and manage medical bills and debt. So let's start off with Surviving Debt is a guide that NCLC put together. It's a pretty current guide, updated in 2021, has lots of tips about how to survive all kinds of debt, including a section on medical debt in particular. Now, what I want to do is highlight some of the very specific ways the guide points out the way consumers can actually manage their medical debt. So first of all, some very specific but general in other ways tips about how to survive debt. So one, prioritize debts whose non-payment immediately harms your family. What that means is prioritize rent so that you can keep a roof over your head. Things that would immediately harm your family if you lost them, prioritize those debts. Number two, don't let debt collectors, credit score worries, stress, or other factors force you into bad decisions around paying a certain debt. Number three, stretch your dollars and your debt and also think long term. Number four, avoid scams and other ripoffs, preying on those in debt. So title loans, those check cashing places, things like that. Number five, know whether and when to file for bankruptcy. And number six, get help from a counselor or a lawyer. And we're going to talk a little bit more about some of these as we go along. A real quick review of Signe-Mary's very in-depth discussion about the medical debt crisis. So medical debt is the most common collection trade line reported on consumer credit reports. Debt collectors contact people about medical debt more than any other type of debt. In fact, Black American families are more often contacted by debt collectors than any other group. Certain groups are more affected by medical debt, as Signe-Mary pointed out. Young adults, people with lower incomes, Black and Hispanic families are disproportionately impacted by medical debt. Veterans and older adults also significantly experience medical debt as well. That may sound a little bit ironic because veterans have the VA system, older adults have Medicare, and that does help insulate some of the effects of medical debt, but it doesn't completely protect them. Medical debt is also concentrated more in the South. A lot of that is due to the lack of Medicaid expansion throughout the South. Hooray for Arkansas and Louisiana for expanding Medicaid, unlike many other states in the South. Medical debt impacts credit scores, which affect the ability to obtain employment, housing, loans, and more. Credit really does affect the way we move through the world. Medical debt is still the leading reason people file for bankruptcy. There's a lot of information about that that goes into even more detail in a really fabulous report that the Consumer Financial Protection Bureau recently released in February. So let's get into some steps you can take to deal with medical debt. So paying medical debt is low priority. Remember, I said prioritize your bills. Paying medical debt is low priority. Do not put medical debt on your credit card. Why is it important to avoid using other debt like loans, credit cards, medical credit cards, etc., to pay off your debt? Well, Credit cards, including medical credit cards, often have a very high interest rates and really unfavorable terms, late fees, penalties, things like that. Unlike credit cards and some loans, medical debt often carries low or no interest or late charges. Financial assistance may even be available to help with the bill. Healthcare providers are often more willing to reduce the amount of a delinquent medical bill where you can show financial hardship. Essentially, you lose opportunities for financial assistance or to negotiate with the healthcare provider once you put that medical bill on a credit card. This is not to say you should ignore medical debt, however. Please don't ignore your medical debt. As noted, it does affect your credit score, which can affect so many other things in your life. So just know that you have other options. Right? And let's keep it moving. So debt collection and medical debt. Don't let medical debt collectors pressure you into making a bad decision. That's the key point here. Do not let medical debt collectors pressure you into making a bad decision. Hospitals and healthcare providers will often turn unpaid medical bills over to debt collectors. The tactics that these debt collectors use can be really aggressive to pressure you. Those tactics include pushing you to put the debt on a medical credit card, encouraging you to pay your medical bill ahead of other more important bills, threatening to ruin your credit rating, even if they have no interest in actually turning your debt over to the credit bureau. So sometimes they use misleading threats like that that they have no intention in following up on to coerce you, so to speak, into paying the bill. Constantly calling you and people that you know, your employer, to demand payment, things that are actually against federal law, as a matter of fact. In fact, the way that credit collectors will sometimes threaten to ruin your credit rating by turning your bill over to a credit collector is particularly interesting. If they do actually report the debt, the credit reporting agency will not even include the debt in its reporting unless the debt is over 6 months old. But the debt collector will rarely ever tell you that part, right? So how to avoid or respond to debt collector harassment? Well, under federal law, debt collectors must stop contacting you if you send them a letter telling them to stop. Contact the hospital or healthcare provider early about how you cannot pay the bill before the matter is even turned over to a collection agency. Contacting a provider about your inability to pay is actually really crucial. Explain to the provider that you can't pay at the present time and that you will not pay the collection agency either. Since the healthcare provider must pay the agency, the provider may be better off actually waiting for you to pay them directly when your financial situation gets a little bit better. Preventing your debt from going to a collector will also help your credit rating and credit standing, but typically only collection agencies and not medical providers actually report your debt to credit bureaus, which is important to keep in mind. So what are some existing protections for Arkansas consumers? The No Surprises Act, which is a federal law, bans most surprise or balance bills, which we'll talk a little bit more about later. The No Surprises Act bans most unexpected or surprise medical bills from out-of-network providers. It was approved in 2020 and went into effect this past January. The main purpose of the law is to protect patients by taking them out of the middle of these billing disputes between insurance providers and healthcare providers. Your healthcare provider bills you for a certain service and your insurance says, no, we're not going to pay that whole amount. And so the provider sends you the balance of the bill. The whole point of this act is to take you out of the middle of that dispute and require them to settle that dispute outside of you and in another process. Under the No Surprises Act, consumers who do receive out-of-network care protected under this law will be responsible only for the in-network cost. Some states have state-based surprise billing laws that add more layers of protection. Arkansas is not one of those states, but nonetheless, the No Surprises Act itself is very robust in its protections. They have a complaint system and everything set up for consumers, which we'll talk a little bit more about shortly. The Affordable Care Act is another federal law that I'm sure we've all heard of that requires nonprofit hospitals to provide charity care or financial assistance. Eligibility requirements vary from hospital to hospital. Hospitals are required to make information about charity care available to the patient before engaging in any extraordinary collection actions. And then Arkansas itself has a law that sets financial assistance requirements for community health centers. Community health centers in Arkansas must provide subsidized care for certain uninsured individuals between certain ages with incomes of up to 200% of the federal poverty level. What are some limits on credit reporting? Well, some splashy news from a couple months ago. The big three credit bureaus, Equifax, Experian, and TransUnion, announced that they will begin removing paid medical debts and unpaid medical debts of less than $500 from credit reports. That's going to help a significant percentage of consumers and patients who have medical debts on their credit reports. These agencies have also agreed not to include any medical debt in your credit report if that debt is less than 180 days delinquent when reported to them. What that means is that the medical debt will not affect your credit score and your credit rating unless a provider's collection agency makes a new report to the credit bureau after that 180 days. Can a hospital turn you away if you owe it money? Unfortunately, the answer is it depends. Regarding non-ER services, if you have an unpaid bill with a hospital, the hospital can refuse you non-ER service, non-emergency service. For ER services, however, if you have an unpaid bill, a hospital cannot turn you away at the ER. This is your right under a federal statute called the Emergency Medical Treatment and Active Labor Act. They cannot turn you away for emergency care. They can't deny you any care at any part of the hospital. In fact, you usually have about 8 months, 240 days or so, from when you first received an old bill to request financial assistance. Until that hospital determines whether you are eligible for financial assistance, they cannot turn you away for treatment either. So if you have an unpaid debt and apply for financial assistance or charity care at a nonprofit hospital, the hospital has to treat you until they determine whether or not you're eligible. Medicaid recipients also are protected. If you're on Medicaid and you have an unpaid bill, hospitals and healthcare providers cannot turn you away or deny you services. Now, this is a trick question, maybe for some folks or maybe not. After care, the patient receives an EOB statement from the medical provider. True or false? Well, if you were thinking true, you are absolutely incorrect. That is false. Your EOB statement comes from your insurance provider. And this is very important when it comes to looking at your medical bills and understanding whether or not there are any errors, resolving those errors. So how do you correct the medical bill? First of all, review your EOB statement and your bill for errors. Always review your EOB statement and bills. You never know when you're being billed for something that you just didn't receive unless you're literally looking at the bill. For errors on your bill, contact your healthcare provider. For errors on your EOB statement, your explanation of benefit statement, contact your insurance provider. Report balance billing charges to the healthcare provider or insurance provider. This gets us back to the No Surprises Act, which protects you from balance billing in many circumstances. So what do I mean again by balance billing or surprise billing? Let me just make sure this is very clear. Your EOB statement may disallow a portion of the healthcare provider's bill. So there may be a portion of the bill that the healthcare provider charged that the insurance says, no, we're not going to pay, pursuant to their agreement with that provider, with that healthcare provider. Balance billing is when that healthcare provider, that doctor, bills you for the disallowed portion, for the portion that insurance refuses to pay. Sometimes it happens when a provider is not in the patient's network, insurance network. Typically, it happens when a patient receives emergency services and they're seen by like an anesthesiologist or some other professional that's not in network, or when a patient has scheduled procedure at a hospital or ambulatory surgical center. At any rate, the No Surprises Act protects you from those kinds of bills. You have the right to file a complaint by either calling them at the number you see listed here or by going to cms.gov if you think you've been balanced bills in violation of that law. So what else? If you've hit a brick wall, you've tried to resolve the bill by calling your healthcare provider, your insurance provider, and you just hit a wall. You have the right to appeal your insurer's decision not to cover you, but it's very time sensitive, so do not delay. Also, do make sure that if you are unsure about the appeal process, that you contact the Arkansas State Attorney General's office or go to their website. They have a lot of information about how to do insurance appeals. This now may be an easy question if you were paying attention. Nonprofit hospitals are required by law to provide free or reduced care. If you said true, you have been paying attention. Kudos, you are absolutely correct. Nonprofit hospitals under the Affordable Care Act are required to provide charity care or financial assistance to income eligible patients. Did you know even that Arkansas is among the top 30 of states with the most nonprofit hospitals? Over 58% of the hospitals in Arkansas are nonprofit. That includes UAMS, Children's Hospital, St. Vincent's, Baptist, Conway, and so forth. 27% are for-profit, and the remaining 13% are government-owned. But nonprofit hospitals often operate in ways regarding debt collection and costs that can lead people to assume that they're for-profits. So requesting financial assistance. Federal law, as noted, requires that nonprofit hospitals offer financial assistance or charity care, such as free or discounted medical services for eligible patients. They can cancel a bill in whole or in part if you qualify for their financial assistance, for instance. The policies must be in writing and available on the hospital's website. Because federal law doesn't actually specify financial assistance or charity care standards, there's a little bit of a no man's land, meaning eligibility and the type of assistance varies, sometimes from hospital to hospital. So you have to read the hospital's policy closely. Some hospitals may offer an interest-free installment plan. Others may offer reduced medical care. Some may offer just flat out free medical care if you qualify. It all depends, so you want to read their plans closely. Other hospitals and healthcare providers may agree to reduce bills based on your financial hardship, even if they're not required to do so by federal or state law. So some for-profit hospitals also have financial assistance policies. When you are in a situation where you simply can't pay, the thing to do is to contact that provider's billing office and explain your situation and your current inability to pay. Ask them for a payment plan if you can't afford to pay the bill after paying your high priority bills like mortgage, car note, and so forth. But if you do get a payment plan, make sure any payment plan you obtain has in writing in that payment plan that there will be no interest and no late fees attached. The last thing you want to do is sign yourself onto something that makes your situation even worse, right? Will a healthcare provider sue you for unpaid medical bills? They can, but it's a little bit yes and no, okay? A hospital or other healthcare provider is generally less likely to sue you to collect on an overdue bill than other creditors, such as credit card companies. This is especially true for smaller healthcare providers, small practices. They're even less likely to sue you to collect on an overdue medical bill. If you request financial assistance from a nonprofit hospital, the hospital can't start a collection lawsuit against you until it determines whether you are eligible for financial assistance. If you are seeing a small practice doctor, just again, call their billing office and ask if they have some sort of financial assistance policy available that might be of help to you. But this is not to say that hospitals can't sue you. Hospitals and healthcare providers can sue you for an unpaid medical bill. And those suits can lead to wage garnishment, bank account seizure, a lien on your home even. So do not ignore an unpaid medical bill. If you're sued, what do? There are many things you can do. You can argue that the bill is unreasonable. You may ask, why is that a legitimate argument? Well, in most cases, patients don't agree to a price for medical services ahead of time, and a hospital or physicians bills you for whatever price it decides to charge. It's a little bit arbitrary, the pricing, really. Some judges may be sympathetic to your argument that the hospital charged you a higher price than the hospital typically charges the insurance companies or Medicare or Medicaid. So if you raise this in a lawsuit, the hospital or healthcare provider may even settle with you for less rather than try to prove that its charges were somehow reasonable. So arguing that your bill was unreasonable is a valid argument if you're sued. Again, you'd want to speak with an attorney before even going that route. I want to end off with some resources for dealing with medical debt. These slides will be made available to you all after this, and the PDF as well. So some of these things that you see highlighted here are hyperlinks. You can click on them and go right to the website. What sources are out there for Arkansans that are struggling with medical debt? Well, the Center for Arkansas Legal Services has some awesome legal aid attorneys that are available to you for free if you're income eligible. You can apply online or call them. Legal aid attorneys do some of the bravest, most important work I can think of. I say that as an attorney. Do not doubt the veracity with which these individuals will advocate for you, but do know they are often dealing with significant backlogs and understaffed. So they may be so booked up that they may not even have the time to get to your case as quickly as you like, but never give up trying to contact them. Credit counselors are also very important. If you're just dealing with debt issues, generally, maybe medical debt is just one of them, and you're trying to figure out how to manage it all, maybe you're thinking about bankruptcy, check with the Arkansas Attorney General's office and the Federal Trade Commission to figure out how to find a reputable credit counselor. And you want a reputable credit counselors because there are some scam artists out there. The link below has a list of credit counseling companies that are approved by the U.S. Department of Justice. And I will end there. I am easy to find at National Consumer Law Center. Again, thank you for this time, and I will turn it back over to Fran.
Wonderful. That was a lot of information from both of you, and I'm really glad we recorded that because I definitely want to go back and especially look at some of the data too that Signe-Mary had. I mean, just seeing, particulars about some of the counties in Arkansas. There were a few questions that came through. So for both of you, I don't know who wants to field the questions. One of the first ones I think was just answered, Berneta, with your last slide. Somebody asked what are no or low cost sources for financial counseling. Now, I don't know what you showed on your slide though, would that be financial counseling, or would that be if you wanted if you knew you wanted help intervening with bills that you couldn't pay for?
Yeah, so, those resources I listed in that final slide, yeah, those are credit counselors. Those are legitimate credit counselors that are listed on the Arkansas State Attorney General site, Federal Trade Commission. And I strongly advise going to those sites because you never know what kinds of scammy companies you'll be running into otherwise. But they help with all kinds of credit counseling issues beyond just medical debt, whether it's figuring out how to get a consumer on a payment arrangement that makes sense to manage their credit issues and their debt issues, whether it's filing bankruptcy. They handle all kinds of credit counseling issues. So you mentioned in one of your slides that if all else fails, write a letter to the debt collector, that if by law, supposedly, they have to stop harassing you if you've written a letter. How does one go about writing a letter to a debt collecting agency? I mean, do you need to find out who they're with? Will they tell you who they're with? And is that information available online? And then who do you address the letter to? Yeah, it's really as simple as getting the letter from the debt collector. They always harass people by mail eventually as well. And so when you get that letter from a debt collector, it's usually from a law office or something like that. You are well within your right to send them a letter directly to where it's addressed from on that letter you got from them, letting them know to cease and desist contacting you. And once you've done that, keep a record of the fact that you've sent that to them. Once you've done that, if they continue to contact you, you should definitely reach out to the Federal Trade Commission. They have a complaint portal on their site. The Consumer Financial Protection Bureau as well has a complaint portal on their site so that you can actually report violators like this.
Right. Signe-Mary, a question for you. How would someone know? You mentioned about the credit report and the debt collectors and impacting your credit report, especially when you're maybe applying for a loan for a mortgage or home repair or even job eligibility. That they can look at what your debt is like. How will I know if I have debts in collection on my credit report? How do I find that out?
Yep. So what you want to do is you are entitled to a free credit report every 12 months from each of the major 3 credit reporting companies that Berneta mentioned. So Equifax, Experian, and TransUnion, they're required to provide you a free credit report. And what you can do is you can go to annualcreditreport.com and just request your free credit report. Or you can Google, you want to go to a reputable source, again, like the Consumer Financial Protection Bureau. How do I get a copy of my credit report? So then once a year, I'd pull down a copy and look through that. Is what's on there, does it look correct? And then also, if you are denied credit, you can ask for the reason why. But I do recommend pulling and checking your credit report so you know what's on it.
And I would add that most people think that when they pull their credit report, they're dinging their credit report. It does not affect your credit report at all when you pull it.
That used to be the case, because where did we learn that? I remember hearing that. Did that used to be the case?
I think it just became one of those things that was assumed, because when you do go to seek like a loan or something like that and they pull your credit report, it does ding your credit report. But that's really because that's someone that's seeking to give you another loan product, some sort of debt product. I think we just assume that anytime you pull your credit report, that's what happens. But because when you pull it, you're not trying to give yourself a loan. So there's no reason for it to ding your credit. There's no reason for it to look like you might be getting ready to open a new line of credit or anything.
Gotcha.
Yeah.
And I think this was a question in the group, and I think I'm understanding it. What groups report to credit bureaus? It said only what groups report to credit bureaus. And I think that's what she was asking.
That may be getting to the question of providers, hospitals, healthcare providers versus debt collectors. Hospitals and healthcare providers can operate like debt collectors, but they are often less likely to turn your debt over to a credit reporting bureau. What they will sometimes do, or frequently do actually, is turn your debt over to a debt collector, who will then turn your debt over to, or I should say, report it to a credit reporting bureau. So if you're dealing with a medical debt and the hospital still has it, you're less in danger of that bill ending up reported to a credit reporting agency than you are if you're dealing with a medical bill and a debt collector already has it. That's really the answer to that. Yeah.
The No Surprises Act that you were talking about, if someone is caught in the middle, that was so interesting to me. I did not know that protection existed. If I'm the patient and I'm starting to see what's about to happen here, what's my first step? Do I go to the insurance company? Do I go to the healthcare provider? Do I go to somebody else? Where do I begin to go down that road?
Yeah, at this point, under the No Surprises Act, as long as it's a type of care that's covered by the No Surprises Act, you should never even be in that situation again where you have to, navigate it. Essentially, you should be completely kept out of their disputes. So let's say there's you get service from a healthcare provider, hospital, and the doctor charges, I don't know, X amount, and the insurance says they're only going to pay a lesser amount. It shouldn't even come to you later. You should never get a
Right.
bill in the mail for the remainder of it. That would likely bump it up against the No Surprises Act, depending on what kind of care it is. So if you are in that situation where you're getting a bill because the insurance chose to not cover all of it, and you're pretty sure that this is the kind of care that No Surprises Act covers, it is extremely important to immediately go to the portal and file a complaint, the No Surprises Act portal, and file a complaint.
Okay.
And the type of care that it usually covers it completely covers is those emergency situations where you'll be seen, it may be an in-network hospital, but there are all these out-of-network providers that operate on you or see you during that care, right? That is completely, you should never get a bill for that.
If you have no control over, I mean,
exactly.
if they're bringing in other people, you don't control the decisions.
You can't choose at that time. And even if you have a helper there, it's still such an emergency situation is a very dramatic situation. No one's going to be thinking that clearly no one should have to.
Right,
Yeah.
right. All right. Well, are there any other questions from our group this evening? I think we've addressed all of them. Signe-Mary, Berneta, do you have any final thoughts or comments before we head off tonight?
Yeah, I would just say, as I said earlier, this is a systemic problem, this medical debt and collections. You are not alone. It's not your fault. We're telling you things that you can do as an individual because we want to give you those tools. But this is really a national, a state, and a local policy issue. This is not your fault. So I'd summarize by saying debt and collections is widespread in Arkansas. It's a big problem and there are things that our country, your state, your employer, and you can do about it. And I just also wanted to say thank you for the opportunity to be here today, Fran. Thank you so much for inviting us, and that I'm grateful to the Annie Casey Foundation for funding the research, to JP Morgan Chase has funded some of the research I presented today, and the FINRA Foundation. And of course, all views expressed are my own. So thank you.
Yeah, I would echo Signe-Mary. This is such a systemic issue. Medical debt is literally, it sounds like an oxymoron. You cannot choose when you get sick. It's not like going to buy a car, take out a mortgage. You can't choose it. So I would very much encourage people to never internalize medical debt, never feel like it's something you did wrong, and really recognize that there are resources out there. They can be a little scant, a little limited, but they're there. Don't ever hesitate to, contact folks for help, legal services. Look at the state attorney general's website, the Arkansas State Attorney General's website. There's a lot of resources there and complaint portals. And just recognize that you have some options. Even though you shouldn't have to do this hard work yourself and this advocacy for yourself, you are going to be your own best advocate. So thank you very much. Also for allowing me to be here and to speak about an issue like this to my home state. And if you ever have any questions, anything that comes to mind, my contact information is there. Do not hesitate to reach out, and I will turn it back to Fran.
Wonderful. Well, thank you both. This is, it's like I said, it's a lot, and I want to go back and watch this and look at the slides, but both of you have kind of given us hope as well, that with people like you, with your eyes on what's going on and what's important and helping have changes come as a result of this, I feel like we're in good hands. So thank you. So this concludes the third session of our 6-part series. So we're going to take a little bit of a break in July and August, but we're coming back in September, October, and November with 3 more sessions. And the topics are buying versus renting. So which makes more sense for you in your particular situation. And of course, right now, trying to buy is a whole other kettle of fish. Staying cyber safe. In fact, October is Cyber Security Awareness Month. And so we're going to have a presenter go over some very basic, simple things that we can do to avoid getting caught up in the web of cyber hacking. And then we'll end it in November with planning for retirement. So all 3 of those sessions, you can go ahead and go to Cal's website right now and register, and they'll be really good about sending you a link a few days before, and then the day before, reminding you to attend. So we hope that you all have enjoyed tonight's session, and please feel free to, like I said, send along a copy or the video so that you all can watch it again, or to your friends and family. And that will do it. So I hope the rest of your week goes well. And thank you all again. And thank you, Berneta and Signe-Mary, for all the time you devoted to this. I appreciate it. Bye-bye.